Hello, everyone, and welcome to today's webinar, ACR Accreditation, What You Need to Know. Before we get started, I would like to go over a few items so you know how to participate in today's event. You have joined the presentation listening using your computer speaker system by default. If you would prefer to join over the telephone, just select telephone in the audio pane, and the dial-in information will be displayed. You may submit text questions today by typing your questions into the questions pane of your control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. Joining us today for the Q&A session are Krista Bush and Leonard Lucy. Krista has been with the American College of Radiology for over 17 years and is the director of the Non-Breast Imaging Accreditation Program. As part of the quality and safety team, her responsibility includes overseeing the CT, MRI, nuclear medicine, PET, ultrasound, and radiation oncology accreditation programs. Prior to joining ACR, Ms. Bush worked as a radiological technologist in the clinical settings for 5 years. Leonard, legal counsel and senior director for accreditation, has been with the American College of Radiology since 1993, serving first as Assistant General Counsel and currently as Legal Counsel and Senior Director for the accreditation. He has been a practicing attorney for 30 years with a primary concentration in medical legal issues. He has served as General Counsel to several Army medical centers. When he retired from the military service in 1993, he was the lead medical malpractice attorney for the Department of the Army and also served as a special United States attorney. Our presenter today is Dina Hernandez. Dina joined the American College of Radiology in 2006 and is a program manager for the CT and MRI accreditation programs. Prior to joining the college, Dina worked as an RT and CT technologist for over 15 years. Dina, I'm going to turn the webinar over to you.
Thank you, Lori. Hello, everyone. Thank you for joining us today for this webinar. And the topic of this webinar really is going to be, what do you need to know to get through your accreditation renewal? And to start off, to clarify, this is about diagnostic accreditation. Radiation oncology will not be covered at this time. This webinar, this presentation, will also be available for you to listen to on our acr.org website. So for the webinar today, we'll go over what do you need to know, how do you get started with your renewal, what are some of your options in your renewal application, such as electronic submission, what resources do you have available to you for information about accreditation, and again, why you should continue with us for the accreditation. At the end of this presentation, again, as Lori indicated, there will be a question and answer session. So really, throughout this presentation, type in your comments or type in your questions, and we'll flag through them at the end. Okay, so what do we need to know? Probably many of you, if not a large percentage of you, require accreditation for reimbursement. That reimbursement may be by CMS, the Center of Medicaid, Medicare Services, or by some third-party payer. We understand that a gap or a loss of accreditation may result in a loss of your reimbursement. So getting your renewals, continuing with your accreditation has become more important than ever. We understand the hardships that the sites are facing with downsizing and consolidating. We understand technologists are trying to perform accreditation, working with accreditation in between scanning patients. So we want to help. We want to provide you with the information that you need to get through the renewal process. So when this all started, the Medicare Improvements for Patients and Providers Act in July of 2008, so they mandated that all of the outpatient facilities who bill for the Part B to receive the technical component reimbursement off that physician fee schedule. They mandated that they be accredited by January 1st, 2012. So now accreditation is for 3 years. So those MIPA facilities, or those facilities who achieve that accreditation at that time, before that deadline, it's time to renew, or your renewal deadline is really fast approaching. So where do you get started? If you are unsure of your expiration date, we strongly recommend you log into our accreditation database, accredit.acr.org, and check your facility's accreditation status. Now that login will require you to use an email address and password. We have a link that will allow you to reset your password if you forgot, but do check that website or that database. And then what is the timeline for renewal? Probably one of the most important things you need to realize is that renewal needs to start 8 months prior to expiration of your current accreditation. We send an email to your facility login person, the login person of your online database, 8 months prior to expiration. We strongly recommend that your accreditation renewal application be submitted no less than 6 months before your expiration date. So keep in mind the renewal email is sent to the login person, which is why it's so important that you keep updated contact information within our accreditation database at all times. That way you can ensure that the correct people receive the emails, those renewal notices. All right, once you submit your renewal application, we're going to start the testing cycle. You'll have 45 days. Everyone will have 45 days to get your materials together and send them to us for evaluation. Now we understand 45 days, sometimes that's not long enough. Give us a call. Reason, low patient volume, you can't find the patients, you can't get your physicist scheduled. Those are all very valid reasons for needing an extension. We look at each situation case by case. Most of the time we can give a 30-day extension on that 45-day due date. A lot of times we'll give 2 30-day extensions. But this is why it becomes so important that you start the renewal as early as possible so that you're giving yourself enough time to request those types of extensions. So give us a call and let us know. Once we get your testing material, it will go through a 30 to 60-day review cycle. So where do you get started? One of the most important aspects of accreditation is the instructions. We strongly encourage you to go to the acr.org website, go to the accreditation page, and review your accreditation resources. Our accreditation page has general frequently asked questions. On the accreditation page, you will find each diagnostic modality links to those modality web pages. Each of those individual modality web pages will have program requirements, frequently asked questions, instructions, testing, and QC forms. Each will also have a toolkit for site visits. And then once you're ready, you've read through the instructions, you've looked at your modality web page for any updates or changes since you performed the accreditation 3 years ago, but now you're ready to start renewal. So remember, we sent the email to you 8 months prior to your expiration. Your renewal link is active in the online database, and you start your renewal application. That renewal application gives you the opportunity to add new units, withdrawal units, to decide if you're going to submit by CD or electronic submission. You'll select modules or exams depending on what modality you're applying for. The renewal testing is the same as your initial testing. You still have to apply for your units and your modules and your exams in the same manner that you applied initially. But you don't have to pick the same exact exams or the same modules. It's all dependent on what you're doing at that time. You will generate a new survey agreement. You will have the opportunity to do electronic signatures in that survey agreement, or if you don't have them, that's fine too. Print off your survey agreement, have it signed by your supervising physician, and fax it to us. But the application itself is considered electronic because it's in our online database. So get through the entire application and submit at the end. We will process that application once we receive your survey agreement and your payment. We will start the testing cycle and email a link to the testing cycle to your facility login person. Your testing cycle will be for 45 days. Again, we understand sometimes you need more time. Give us a call. Once we receive your materials, we are going to send them to our experts, which are our physicists and radiologist reviewers. They're volunteer reviewers. They work at their own facilities, and they review your submission to make sure it is following the ACR accreditation guidelines and requirements. Once that review period is complete, a final report is generated with the results of the accreditation, and we currently email that to your modality supervising physician and facility administrator. In the future, we will be sending that email to the technologist contact as well. So let's talk about just a few of the decisions and selections you have within your renewal application. So right now you have a choice of CD or electronic submission. And I strongly encourage you to attempt or try the electronic submission. We have the system called Triad, which is the transmission of images and data. Triad allows your facilities to upload images directly to the ACR. Benefits include decreased turnaround time and, of course, decreased shipping costs. You're directly uploading images to us, so we don't have to wait for shipping from you to the ACR, from the ACR to the reviewers. It is a faster, simpler, and secure process. It's HIPAA compliant digital image submission. The way we have the capability to upload right now is we have a web client where you can upload images, and we have a Windows client which will allow you to upload entire folders of exams or even connect directly from your PACS machine. So the web client, it does not require any software download. You can select images and upload them directly into Accredit, to the ACR. You will get little thumbnail images of your uploads and a summary page that will tell you the amount of images that you have uploaded. Now the Windows client does involve a download and install on your local computer, so you may need to get your IT involved. But the Windows client will allow you to upload entire folders of images from your browser, entire exams. It will also give you the capability of downloading a DICOM viewer called Clear Canvas. This will allow you to see your images the way our reviewers will see them. You will also then get a printed patient or an exam summary telling you the amount of images that you uploaded. So where I do encourage you to try the electronic, we are continually making improvements and enhancements to the system. We might use a different viewer. We're continually trying to enhance this so that it becomes a simpler process for you to get images to us. If it didn't work before, maybe try it again. We always have the capability before you submit your testing material to change you back to CD. We'll work with you. We also have a Triad support team that can help you with IT issues. So what other resources do we have for accreditation? I already mentioned we have, on the ACR website, we have the accreditation webpage. There on the accreditation webpage, you'll see general frequently asked questions, as well as a listing of the available modalities, diagnostic modalities, like the MR, CT, nuclear medicine, ultrasound, PET. Once you go into each modality website, you're going to get a tremendous amount of information. You will see the program requirements, the modality-specific FAQs, testing and QC forms. Also on our websites, we have these presentations available for you to listen to. We have a CT accreditation presentation, a breast MRI, a nuclear medicine and PET, and like I said, this webinar as well will be available. One of the newest web pages that we have available is the Triad Health webpage. So I encourage you to investigate that and research and get information from there. So MIPA sites are coming up for renewal. It's coming up fast. We want to help you with that renewal. We do not want to see anyone lose their accreditation or have a gap in their accreditation that may affect the reimbursement. Renewal links are sent out 8 months prior to accreditation, and we strongly recommend you submit your renewal no less than 6 months before your expiration. We want to get you successfully through that renewal process. We want you to maintain that gold seal accreditation status that you have earned and you deserve. ACR has always been the leader in imaging accreditation, and the numbers prove it. Since 1987, we've accredited over 36,000 facilities within 10 imaging modalities. Our accreditation has been always based on ACR practice parameters, technical standards. It's always focused on quality and safe imaging. And it is peer-reviewed. It is radiologists and physicists that work across the country reviewing your material. So our renewal application is electronic. It's done within our online database. And you have the option for electronic image submission. So we really are trying to make it as simple and easy to get your renewals to us. Our review cycle is 30 to 60 days. We have a hotline for accreditation where you can speak with dedicated staff technologists for each modality that will help you with all of your technical questions. We also have a group of associates that can help you through your application questions, through your mobile unit scenarios, through your leasing time situations. So please, give us a call. Once you achieve your accreditation, we have a custom marketing toolkit. This toolkit is given to you upon accreditation and helps you market your facility that will help you set yourself from your competitors. Remember, ACR is nationally recognized. What you see here are our 10 gold seals, our modality-specific accreditation programs. And I can tell you, patients look for these gold seals. It tells them that your facility really does meet the highest quality standards in medical imaging. So in addition to accreditation, we do offer 3 very distinguished distinctions for your facility. We have Breast Imaging Center of Excellence, we have Diagnostic Imaging Center of Excellence, and we have the newest Designated Lung Cancer Screening Center. So we offer these to our already accredited facilities, and information regarding these programs can be found on our acr.org website. To really get started, if you take anything away, it's start your renewals as soon as possible. get your materials to us so that there is no gap in accreditation. Please give us a call at any time if we can assist. All right, so right now I'm going to turn it to Lori, I believe, to begin the question and answer portion.
All right, thank you, Dina. We're now going to begin answering the questions submitted during today's presentation. As a reminder, please submit questions through the questions pane of your control panel. Dina, as of now, you must have done such a great job. There are no questions.
Fantastic.
We'll just give it a few more seconds to see if any of them come in. Is there anything else, Dina, that you might want to add while we're waiting for questions?
No, just, if anyone has any questions, they come up with anything, make sure they just give us a call. Our accreditation numbers are posted, or our email addresses are posted here on this last slide. Use them, we answer them, we look at these email inboxes on a daily basis, and then give us a call on the accreditation hotline.
All right, well, since no questions have come in, I'm going to go ahead and close. I would like to thank everyone for participating in today's webinar. If you have any follow-up questions, please send your questions to info@acr.org. At the end of today's webinar, please complete the 3-question survey. Today's webinar was recorded and will be available on the ACR website, acr.org, within 48 hours. On behalf of ACR and our presenter, thank you for joining us today and have a great rest of your day.
We do have